miss anything and wish to watch it, you can go from there. So thank you all for tuning in on this Friday evening, sacrificing your couch time, your dinner time, your movie time to come learn about some strategies to help combat your upper back pain. For those of you who don't know us, my name's Luke and my handsome colleague over here is Bryan, and we are both osteopaths over at McFarlane Clinic in Bayswater North. We both have a big interest in exercise prescription and mobility exercises and strength exercises for every part of the body. But one thing we have been seeing a lot of recently is people coming in with upper back pain, more to do with desk posture and working from an unideal setup at home due to the coronavirus lockdowns. So that's what we're going to be focusing on today. We're going to be focusing on strategies that will help you reduce your pain and potentially prevent pain whilst you are sitting at your desk. What we won't be covering are specific conditions and other causes of back pain, and there are many other things outside of what we're going to be doing today. So, as I've already said, what we're covering, some exercises for your upper back. So mobility exercises, being movements, being some stretches, being just getting generally moving. We're then going to also cover some strengthening exercises for your neck and for your upper back. And then Bryan is also going to be talking about desk setup ergonomics. So how best to set yourself up in whatever situation you are. Bryan is the ergonomics guru, so you're in very good hands there. But before we get into our content though, just a couple of little disclaimers. First of all, the advice that we are presenting here is general only. That may not necessarily apply to your specific situation. So if you do have any specific queries, concerns, you can ask them in the chat box, but it's probably better to seek a healthcare professional so they can deal with you one-on-one. So everything here is just general only. Also, what we are covering is definitely not an exhaustive list. There are hundreds and hundreds and hundreds of various exercises that can be done, but we're using the ones that we find the most effective. If we had 10, 15 hours to sit here and talk, we probably could, but we don't. We want to try and keep this short and sharp tonight so we can all go watch Netflix. And the final point here, we're going to talk about this, probably Bryan and I will mention it multiple times. Whilst we are presenting various exercises that we do find effective, it doesn't really matter what exercise you do as long as you do something. If you get up and get moving, generally you start feeling better. So any exercise is better than no exercise. And now let's get into the meat and potatoes of this thing. So before we talk exercise, I just want to cover off a few concepts that will be talked about as we go. And pay attention to this. There's going to be some quizzes as we go. So we're going to be testing you just what you want in your Friday night, some tests. What we're going to be going over here is movements of the back. And we're talking mainly about extension and flexion and rotations. We're not really going to be covering off side bendings. So I just want you to understand the terminology so you don't get confused later on. A flexion movement is a bending forward movement, and we're talking in relation to the upper back here. As you're bending forward to do your shoes, bending forward to pick something up off the ground, that's a flexion movement. An extension movement is bending backwards. More commonly seen when you're trying to reach above head to something, that's an extension movement. A side bending movement is, as it says, you're bending to the side. So the way we would generally test that is if you're running your hand down the outer part of your leg from side to side, that's a side bending movement. And a rotation movement is really self-explanatory. You're twisting. It's rotating left and right. But the main one I want you to remember is flexion is bending forward and extension is bending backwards, because Bryan and I will use these terms quite a lot throughout the presentation. The next concept I want to quickly cover as well is that of spinal posture. When you look at the spine from side on, it is actually curved. It's not dead straight. It has a curve in it naturally. We're mainly concentrating on the upper back. So if we talk upper back first, it has a bend forward, so a slight flexion, commonly termed kyphosis. That's a medical term for it. That is completely normal. Up in the neck, we have a slight extension, which is bending backwards. And in the lower back, we have a slight extension, again, bending backwards. That is normal. That is normal anatomy, normal posture. So if you ever look at an x-ray and it has a bit of a curve, that's fine. That's how it should be. As we then talk desk posture or sitting posture, we can end up overusing that kyphosis, that flexion curve through our upper back, and that can lead to potentially a bit of discomfort. However, when we talk posture, there is no such thing as a perfect posture. No matter what posture you're in, if you're not moving out of it, that's when you're going to come into difficulties. That's when you're going to become stiff. That's when you're going to become sore. So you could be fine sitting like this for a short period of time. As long as you move out of it, then you'll be okay. As well with posture, our body needs to be able to have the mobility to move in and out of that posture, and also the strength to be comfortable in that posture, to be able to control that posture, and then to be able to move within that posture. So when we're talking posture, there is no such thing as perfect posture. We need mobility and strength to be able to move around it. So now that we're talking about movement, let's get into our exercises. Okay, oops. What's going on here? There we go, perfect. No, but I've gone too far. Sorry, all right, here we go. Okay, technical difficulties. Sorry, it's a Friday, things aren't wanting to work. So the first exercise I'm going to cover right now is needle threads. And you might have already seen the answer because of the technical difficulty there, but I'll get you to watch this video. And once you have watched it, let you type into the chat box what movement of the upper back you are training with this exercise. And pay particular attention to the funny dog in the background. All right, can anyone hazard a guess in the chat what movement we are training here? Brian, you're not allowed to answer. And no one wants to have a guess? We'll show you again. So what movement of the upper back do you think we are training here? So we've got flexion, extension, we've got side bending, we've got rotations. Oh, here we go. Someone's answered. Yes, it is.
Good.
Great work. It is rotation. So the reason we are training rotation is that in a seated posture, we'd never rotate. We're always reaching in front of us. We're always just reaching a slightly bit to the side of us, but we never have a twisting movement. And for natural, healthy, pain-free almost living, you need to be able to move in all directions. So if we can get rotation, that is going to help us immensely. So what I'm doing with this exercise here, as you're seeing, I'm on my knees, I've locked my hips, they aren't moving, and I'm just reaching my arm underneath my other arm. It's called a needle thread. So you imagine the arm coming through is threading the eye of the needle. This may not be possible for people with knee issues or knee pain, potentially those with hip pain or back pain, but there is a modified version where you can just stand up and do that same twist, or as I'm doing now, I can do it seated, sorry, not seating. Getting my words confused. So there is modifiable according to if you can't get onto the floor. The next one is a raised arm cat camel. So I'm not sure if any of you have come across a cat camel exercise before, but I'll show you a video of it in a moment. Now, as you're watching this, what movement or movements potentially do you think are being trained as you're doing this cat camel exercise? Remember, we've got flexion, extension, side bendings, and rotation movements. So if you're having a look at the videos, what ones do you think are being trained here? And feel free to throw it into the chat. We have an answer here.
Nice one.
Okay, Mon's cheating. I know Mon, she's an osteo. She comes with prior knowledge. That's cheating, Mon. Yes, but you're right.
Right though, yeah.
Flexion and extension. So that is that movement of bending forward and bending backwards. Okay, what have we got? Another one in the chat. Thanks, Mon. So the reason we're training this is when we're sitting, again, generally we're not moving too much forward and backwards. We just tend to have a reach. And what tends to happen in sitting position is we end up with more flexion. We end up hunched forward, which is your typical bad posture. And what people then tend to lack because they get stiff into that posture is the extension movement. So by doing a cat camel with your arms, elbows raised up on the chair, it gives you more opportunity to get extension through your upper back. As I'm coming down, what I'm aiming to do here is get my chest straight down towards the ground. And I'm doing that by slightly kicking my bum back, kicking my pelvis back, and then pushing downwards a little bit through the chest. As you're doing this, you should feel the work being done through your upper back. You could potentially also feel a lot of stretching happening through the back of your shoulders. So this is also a great one for shoulder mobility, which is something a lot of people lack when they tend to get stiff in that area. So if you have difficulty raising your arms up above your head, this is a fantastic exercise to get that movement. If you do have shoulder pain or shoulder difficulties and you don't like this position, you can do it on all fours. And again, we can modify downwards to make it easier if you're not comfortable on your knees. There are varieties of that, but we're not going to exactly cover that right now. All right. This final mobility exercise that I am going to cover is called a shoulder dislocation. It is better than it sounds. So now, as we watch this, can anyone hazard a guess as to what upper back movement we are training here? It's not that scary, Maddie. It's actually quite a great exercise. So if you have
scary, but yeah.
So if we have a look at this, what is happening at my upper back as I'm bringing the bar over my head? What do you think is happening? Remember, we've got flexion, extension, side bendings, rotations. Anyone want to hazard a guess? This one's probably the trickiest one of the lot. I'll go again with one more rep. Anyone? Mon, if you can jump in if you want. So have a look at what's happening at my upper back. What am I having to do? All right. Oh, we have someone popping in. Yes, it is extension, correct. Fantastic work. So as your arms are coming above your head, your upper back is actually having to bend backwards. So that is creating a bending backwards movement as I'm moving my shoulders. This again is training you out of that hunch forward. What this exercise is also great for is opening up through your pec muscles, opening up through your chest. As we sit a lot, we tend to hunch forward, but our shoulders also tend to roll forward. Again, your typical bad posture. But if we can use this exercise to bring the bar up above our head, we're actually going to really stretch out our chest. We're going to be arching our back backwards, and we're going to be opening ourselves up. It's fantastic for upper back mobility. It's fantastic for shoulder mobility. If that is too easy for you, however, you can do a seated variety. And the reason this seated variety is harder is we are now not able to move your hips or your lower back. They are locked in by the ground. So all the movement has to come from your upper back and shoulders. So it just makes that tiny bit more difficult to do, but also emphasizes the movement a little bit stronger. Be careful with this exercise though if you have a pre-existing shoulder injury. It's probably not appropriate for people who have existing shoulder pain or unstable shoulders or some form of injury there, as it is quite aggressive on the shoulder movement. Another way you can make it harder is to narrow your grip. The wider the grip, the easier it is. The narrower, it makes it a hell of a lot harder. I've seen a few people who do gymnastics and wrestling and they can hold a very narrow grip and get it, but they are just freaks of nature. That is my final mobility exercise, and I'm going to go through one strength. Oh, yep, sorry, yep, go for it.
Just got in there. Yep, so just maybe just wanted to add in that when you're doing these stretches, they shouldn't really be painful.
Yep.
So if you're doing it and you kind of feel like it's like a sharp pain, then that's probably an indication you're not doing something right, or the exercise is probably too hard, or you just got to change something. You kind of want to feel that uncomfortable kind of, like an uncomfortable but comfortable feeling where you feel like, oh, it's a nice stretch. That's kind of what you're targeting, isn't it?
Yep, correct. Absolutely correct. Through any of these exercises, you shouldn't feel pain. You should just feel some form of movement happening. And whoever said extension, I think that was yes, you are correct there. All right. What I'm going through now is just the start of our strengthening part. So what we are training here with a shoulder shrug is this muscle here called your upper trapezius. Now, feel free to put in the chat if you've ever felt tightness in this area, tightness, achiness, something like that. I'll be very surprised if none of you have not experienced this. What have we got?
Yeah, a lot.
Yeah. Yeah. Everyone does. And there are a variety of reasons why people do experience tightness here. But if I'm talking desk-based work, again, seated work, what I'm starting to work around with is that it's not actually tight. What that tight feeling is, I'm proposing, and I have read a bit of research that backs this up, is that the muscle is a bit fatigued and a bit weak. So imagine you're sitting there at your computer all day and you've got this muscle here supporting your shoulders. If your shoulders are drooping all the time or they're up a bit high, doesn't really matter which position they're in, but especially if they're drooped down and your elbows aren't supported as you sit. I'm having trouble with that word tonight, as you sit. This muscle here is going to be working to hold your shoulders up in position. Now, imagine if I asked you to squeeze your hand at about 75% capacity for 3 hours straight. What do you think you're going to feel? You're going to feel fatigue. You're going to start feeling some soreness. You're going to feel like it's aching, like it's really uncomfortable. That is what's happening to this muscle here. So to avoid that feeling of fatigue, of achiness, we need to strengthen it up. And a very simple exercise, as I've already shown here in this video, is the shrug. Now, I've got a bar here because I filmed this straight after I did the dislocation exercise. But as Nita is doing just there, you can just sit and bring your shoulders up and down. You can bring them up, hold for a count of 3, drop them down. Bring them up, drop them down. You can combine that in a bit of movement. Up, roll back and down, up, roll back and down. So that creates a bit more of a mobility exercise with a strengthening component. So there are a million varieties of a way to do a shrug, but as we've said earlier, it doesn't matter what exercise you do as long as you do it. So if we start building a bit of strength in these areas as well as the mobility, we should be able to tolerate our postures a little bit better. So I believe that completes the parts that I'm covering, and I'm going to continue on with Bryan into the strengthening. But before I pass over to him, does anyone have any questions at this stage? From Mon, wine bottles in each hand work too. Yes, that works. If you want an elbow exercise, the bending the elbow with the schooner of beer, but we're not covering elbows today. Any questions before we move on? No, it doesn't look like so. So I'm going to pass over to Bryan now to continue the strength work component. Take it away, Mr. Dinh.
Can you stop sharing your screen? So we can do that, please.
Go for it.
Lovely. Thank you very much, Luke. That was a great start and a great couple of concepts and stretches that we can really use to help manage our neck and upper back pain there. Just wanted to reiterate his point. We do want to provide everyone with these exercises to help manage your aches and pains, but it's kind of really important that we can do these. So you take the time, even if you can only do them for a couple of times a day or a couple of times an hour, that's just going to be really important in breaking down that cycle of being in that slumped over position for a long, long time. So we say any exercise is good and any movement that you do is good. So really, really want to reiterate that point that it's really important just to move, even if it is a little bit an hour, it's going to help and add up. So all I'll be covering today, I'll be covering up the desk setup. I'm just going to quickly run over that. We're going to be looking at some desk-related strengthening exercises, and that's going to be more targeted at those working from home and at their desk. And we're just going to finish off with some general back and chest exercises to round that off, and hopefully by the end of it, get everyone feeling good. Alrighty, so just starting off with the desk setup. I did cover this a few weeks ago, but we've got a couple of new patients coming in that have requested this, so we'll cover that. Just a quick plug before we start, I did upload a Instagram video earlier in the week, so I'll put that link in the chat. So if you wanted to refer back to it after this webinar, feel free to do so. But if we're looking at desk setup, it's really, really important that we have a desk with backrest. So it's really important that we have the backrest because it allows our body to kind of sit back in an upright position. And in doing so, just gives that back extra support. When we're sitting in our desk, we want to make sure that we're seated nice and close towards the table. And we can see from our shoulders, when we're sitting close to the table, we want them nice and relaxed. So with our shoulders nice and relaxed, we want our hands and our arms to be parallel with the table there. So if you're unable to do that, you might want to adjust your seat height, or you might want to add some towels or some cushions underneath to help elevate your seat. So you are resting that trap muscle, as Luke was talking about before, and just allowing a more comfortable position to work from. Looking at the angles at your hip and your knees, we want to aim for about 90-degree angle at your hip and 90-degree angle at your knees. And ideally, we'd have both feet rested on the ground. No crossing of legs or anything like that, please, because it's not so good for your hips. And if you can't touch the ground, which some people are a bit short of, they can't, it's recommended that you put some books or a shoebox underneath to help allow you to rest your feet on the floor there. So looking at the monitor level now, so setting up your monitor, you ideally want to have the monitor about an arm's reach away. So if you're sitting there upright back in your seat, have your arms out reach, and that's where you want your monitor to be. You want your monitor height to be elevated so your eye is in level with the top third of your monitor. And this is important because it's going to stop your neck kind of strain through your neck there if that's in there for a long periods. So we can see through here that the keyboard and the mouse are nice and rested there, and you can see that the wrist angle is nice and straight. We want to avoid any kind of cocking of the wrist for too long, as that can lead to kind of wrist injuries there. In the event that anyone uses a laptop, again, we want to make sure that our monitor is elevated. And what we actually recommend is for our keyboard and our mouse, we want to make sure we have a external keyboard and mouse. And this is going to help us avoid the hunched over position. And we can see from this image here that hunched over position puts a lot of pressure through that upper back there. So we talk about forces and what our bodies have to deal with. A constant force that we have to deal with is gravity. So if we can sit back with our head kind of resting over our head there, our body and our upper back won't have to work as hard to keep our neck upright. It's when we're in that slump position, for example, if we don't have a nice backrest to sit back in, if we don't have a nice external keyboard, or then we're crouched over our laptop, or if that monitor's a bit low, then that's going to promote this kind of posture. And you can see the force is needing to hold that head up. It's going to work really hard. So as Luke said before, there's no real thing as a bad posture. What's bad is if you stay in it for too long. So your neck and your upper back could probably sustain that posture on the right for 1 or 2 hours. But if this is how you're sitting constantly for day in, day out, 8 hours a day, then you might run into some issues there. So that's just to explain why we've set up our desk how we are. And yeah, awesome. So the next thing I want to talk about is some strengthening exercises. So these exercises, the next 2 exercises are really specific to desk workers. And what we're trying to do here is we're going to teach our body how to sit. So the reality is that when we're sitting, towards the end of the day, a lot of us will actually slump forward. And this is partly your fault, but partly not your fault, because what happens is the brain is going to work most efficiently. So it's going to maintain the posture that's most energy efficient, which is that slumped over position. So the aim of these next 2 exercises are actually going to help us in that position, in that slumped over position, and hopefully we can strengthen those muscles to kind of ease your aches and pains. So how we're going to do this exercise is we're going to have sit in our desk. We're going to have our feet rested on the ground. I'm going to push our chair nice and close to the table. We're going to have that belly button in line with our table there. Okay, so if you're too low and your belly button's below the table, we might want to add some cushions or adjust that chair. Okay, so what we want to do now is we want to grab a book or a laptop close to our chest. And what we want to kind of do is bend from our neck and our upper back over the table there. So you can kind of see that bending over is replicating that slumped posture. Really, really important when we do this exercise is we don't move our hips and our low back there. We really want to keep them still. And what we want to kind of do is move from our belly button level and above. And we really want to be feeling a stretch through the upper back there in between our shoulder blades. For a lot of people, having your book close to your body is going to be quite easy. So what I would suggest is have a book or a laptop kind of above your head. And what you want to try and do here is, again, bending that upper back over like you're bowing down to something. Remembering this is an upper back exercise, you really want to be feeling the tension through your upper back there, and you don't really want to be moving too much below the line of your belly button. Okay, so we recommend doing that one 3 sets of 10.
And also with that, sorry, Brian, just don't use your shoulders to lift it up and down. As Brian said, it's an upper back exercise, so we don't want to see you just waggling your shoulders around in the air. Yep.
Sounds good. So not like that. You kind of want to pretend it's a back exercise. And you know you're doing it right if you really feel that upper back work. And you can kind of see when I'm in that bent over position, that's going to replicate a slumped posture. So this is really, really specific and can be really effective for those desk workers that have pain in that general upper back region. So that one there was a back flexion exercise. We can also do that to do an extension exercise. So instead of starting in an upright position and bending down, we're just going to replicate that and go back up. So again, level 1 can be starting with that book close to your chest, starting in a bent over position. And what you want to do is try to straighten up that back. So really want to make sure you're not moving through those hips and the low back. It's really specific to the upper back there. Again, if this is too easy, we can use an outstretched hand to add a bit more force going through that upper back. And we can see there that the shoulder, like Luke was saying, is moving in line with the back. We're not just moving our shoulders up and down. So just moving up like that. So that's going to be really, really specific. And if I was going to pick important exercise to do out of this presentation, it would be these two. And I'd recommend doing this 3 sets of 10 on a daily basis. Lovely. So the next thing we'll cover, we're just going to cover just some general back and chest exercises. The first one is a back row. So the back row is a good exercise to do at home, and that's just going to be good to build the strength of the back muscles. These back muscles help to support your neck and head, so it's good to build the general strength through there. So to set up this exercise, hold onto a door frame with your arms kind of at chest height. Keeping your back straight, you want to have your toes kind of close to the door frame, and you want to be on about a 45-degree angle. All you want to do here is pulling through your back, and between your shoulder blades, you want to pull up so your chest comes closer to the door frame there. You really want to be feeling this again through that upper back region between your shoulder blades, and these are good exercise to strengthen up your upper back strength there. If you find that's a bit easy, we can also do one that's a bit more advanced. So I've seen this one floating around Instagram, which is quite good. Doesn't need any equipment, which is good. And this one, to set up, again, it's really important that we have our back straight. So with your back straight there, have a bend at the knees and your feet planted on the ground. Again, what we're trying to do is we're trying to pull our chest up towards the table there and feel it between our shoulder blades.
Yeah, with both of these, if you're feeling your elbow and bicep fatigue, you're not using your upper back enough. So.
Yeah, exactly right. So you're probably doing something funky with your arms. You want to try and cue those muscles around your shoulder blade. Good point, Luke. And the last one we're going to run through is a chest exercise in the form of push-ups. We know the chest muscle actually attaches onto the shoulder, so it's important to train the chest as well. And just thinking osteopathically, which we think a bit more general, the body in general, we're working all the muscles on the back. It's important that we kind of address and strengthen a bit of the muscles at the front as well. So that's why we're going to address the chest muscles here. We've also seen quite a few patients, I've seen 2 this week, that have come in with problems relating to push-ups. And the main reason is that when they're pushing up, they've got their shoulders out at kind of 90 degrees to their body. So what this does is it really disadvantages the chest, and it actually puts the shoulder girdle under a lot of strain there. So what we recommend is kind of having your arms in front of you at about your nipple kind of level. What you want to do is when you bend back, have those elbows nice and back on a nice 45-degree angle. And this is, when you make this change, you're going to feel it a lot more through your chest. So if you're finding it tough to do a push-up, and because you're doing this form, you can regress it by kind of pushing up on an incline, so having your arms up on a bench, or you can also use it so you're kneeling. So they are ways that you can kind of build up your chest, and yeah, they're obviously very important in the function and the strength of your neck and shoulders there. So that wraps up the presentation. We will just thank you everyone for tuning in. We just really wanted to run these webinars just to empower patients to kind of have some tools to kind of manage their aches and pains at home. So give those mobility exercises and those strength exercises and those desk changes a go. And you can always contact us. Me and Luke have been working now. We're available at McFarlane Clinic in Bayswater North. And probably the best way to contact us is through our socials there. So at Luke KUK, is it?
Yeah, that's the one.
Luke KUK Osteo and Bryan Dinh _Osteo. So yeah, we'll open up to questions now. If anyone's got any questions, I'll also post the link to the desk setup at home there. So if anyone wanted to check out that video, save that link. Do we have any questions?
Yeah, fire some questions at us. We're happy to answer. We're happy to talk about anything. We like hearing the sound of our own voices. No, it doesn't
pretty
appear
good. Everyone's pretty happy with that?
Hang on, here we go. Yes. So it depends. So the question is, with the shoulder shrugs, would you recommend using weights? Eventually, yes. But if you're starting off from a base of no exercise, no weight training, anything like that in the past, just use body weight. Then add maybe a bar or a bag of shopping or something like that. But yes, eventually we want to build up to using some form of resistance weight. We don't need to be going in and doing 40, 50, 60 kilo shrugs. That's probably more of a training performance thing rather than an injury pain prevention thing. But for the general population, yes, we can use some weight, and it will be great to progress to that, but it's not always necessary. Hope that answers your question there, Yas.
Awesome.
Do you have anything to add to that, Bryan?
No, that sounds good. That sounds good. The question will be kind of why you're doing it. If you're getting pain, like you mentioned there, a lot of time it is actually a fatigue or a tension through that that muscle. So it is important to get it moving throughout the day, as well as do those exercises.
Do we have any other questions before we start signing off? As I said, throw anything at us. Something